So, welcome to a brand new episode of The Human Under Scrubs. Today, the human with whom we are going to speak to is a tall personality from the field of urology. Now, in my clinical experience, I have seen that certain surnames, as I was in my growing years in medicine, some surnames were associated so tightly with certain specialities, and so is the surname Kirpekar with the field of urology. Today, we have the privilege and honor to speak with Dr. Deepak Kirpekar, who is going to speak his heart out about his life, what it has been so far in the field of urology. This podcast specifically is for those learners in urology, those surgeons who are shaping their careers right now to gain inspiration from such inspiring personalities.
Thank you so much.
Thank you so much, sir, for agreeing to speak to us today. I and Purva are going to have a heart-to-heart talk with you.
Thank you.
We're honored to have you here, sir.
Just looking back, sir, over 4 decades of clinical experience now, so much lives made easier. Today, when you look back, I know the journey is still ahead, lot of things to do more. But when you look back 4 decades, what's the feeling now?
Look, I came back in 1980 from England, so it's 44 years now. It's very difficult to dissect what happened in 44 years because there's profession, there is family, there's friends, there is social service. And they are all so integrated part of each other that you can't separate them. But I can tell you one thing, I've been very lucky to achieve what I wanted to do in the respect of all the 4 branches. And I thank my friends, I thank my colleagues for helping me to reach that level.
No, that's very humble of you, sir. But going to our MBBS days, I think Purva, you'll have some curiosities, right?
I really wanted to know that what was your childhood like? When did you know that you wanted to do this? When did you want to become a doctor and then a urologist?
I was born in a small place called Solapur, small then. My education has been Marathi medium. Those were the wonderful days of walking to the school with dabba in hand, lot of time to play. My father was a ex-army man and a surgeon himself.
So, sir, I want to know about your childhood. What were your experiences, or what was your childhood like that led you to make this decision to become a doctor and then also specialize in urology?
As a child, I have definite memories. If a ether smell came home, my father is home. I don't use ether anymore these days, but it was very clear cut. And so often I have seen people waiting outside the gate to thank him. And that was a profession that I wanted to follow. And so, actually speaking, to tell you the truth, I wanted to fly. Oh, my mama was a pilot. Okay. And I wanted to join NDA and become a fly. But everybody in the house, my mama died in an accident, and they said, no way. And that's how I became.
Wow, interesting.
I mean,
That-
how events actually shape decisions in our lives. No, I mean, we come up with a motivation to do something, then we get influenced by so many things. And your journey ultimately led you to your MBBS days.
Absolutely.
No, I can also remember from my days, like mine is not very far, like 25 years back, but I remember that those MBBS days are like the most beautiful days of our lives. We see our friends growing up from those very naive, 12th standard passed out, so mature professionals by the end of 5.5 years. How have been those years for you? How many friends or any specific memories from those times?
I have a hostelite since the age of 16.
Wow.
So matric was in Solapur. I have good friend circle in Solapur still today. My college days were Ferguson College for 2 years.
Yeah.
And I still have lots of friends from Ferguson College. Wonderful days. I had an admission option to go to Solapur Medical College.
Mhm.
And my father was the one who said no.
How?
If you come to Solapur and do very well, they say he's Kirpekar's son, he has to do it. And if you do bad, they'll say, in spite of Kirpekar's son, he's useless. So the best is you go in the ocean
And that's how I went to Grand Medical College, Bombay, where nobody knew me, nobody knew what's going on. Yeah. So those were the days where there was no recognition. We had to stand on our own feet, do whatever we wanted to do, and that's how MBBS days were.
I mean, I can see from your resume, I mean, you had topped in first year in both anatomy and physiology. I mean, normally, if you see, one is a very factual, memory based, and physiology is more of logic based, like more of physics. Yet you topped in both, and then going on to the third year, you're the topper or one of the top three in surgery in your college, in the university. So even when I was doing my medicine, it was always my curiosity. When do people really decide their specialty? Is it only the NEET marks nowadays where you have to choose, or it is really it really gets built in your minds and hearts that okay, I want to become a surgeon? What was it with you that time?
I think the question is perfect. The whole thing starts with anatomy. Okay. Anatomy is the basis on which the surgery is based upon. Mm-hmm. So if you have a liking for anatomy, which is literally like mathematics, I must take advantage of this interview and thank Mr. Gray, the one who wrote anatomy 200 years ago, which is unchanged. Imagine the kind of workings they've done to create that book. But then when you know your anatomy, you are going towards surgery. Physiology is basically a functioning of an organ. Our time teaching was different. Now teaching is changed. Now anatomy, physiology is all applied together. Yeah. So in the first MBBS, it's all application based. Yeah. Very good way of learning now. But in our time, anatomy means surgery. Right. You asked me that question. I was topper in Gynec in Bombay University.
Oh, okay.
But I didn't want to do it. Okay. I was second in medicine, but I hated medicine. I was third in surgery. And I had a very good friend, Keshav Joshi, who was the one who was insistent that I should join urology. Urology was just about developing. The first MCH in urology started in 1974, and I'm talking about 1974. Mm-hmm. So it was just about coming up. In Bombay, there was no urology unit, but it was the future. And that's why urology was decided.
I mean, that's such an important information. I mean, today people have to really depend upon their NEET marks to decide. It's not really their passion which they follow. Those who are top rankers, maybe they get. But in your times, I'm really impressed that people usually would have gone and started practice after general surgery. But going on to a subspecialty like urology, I think that was a brave decision that time. Do you feel?
Yes. This was primarily because of the honorary consultants that we had in JJ Hospital. Most of them were travelers. They were trained in England. And so every time they came back, they brought some new technique, they brought some new equipment. And we were, as students, always curious to know what's happening. Believe me, in 70s, India was about 20 years behind the rest of the world as far as medical, technical science is concerned. And so I remember third MBBS onwards, it was necessary that all of us filled in forms to go to UK or go to US. We used to sit together, 30, 40 people together, fill in form together. So it was a tradition. After you do, you've got to go out, you've got to see the world, you've got to expose yourself to newer techniques and then come back. Most of us friends who went to US didn't come back. Whereas most of us who went to England did come back. So that was super training that was necessary. I must tell you one thing. I was a registrar to Baji Kulabawala, the only urology unit. In 76 July, I unwrapped the endoscopic equipment and I went to England on the 1st of August, 76. And in England, TUR was the standard procedure. So there was a lot to learn having finished MS.
Amazing.
I did want to ask you this, that you traveled to England for your future studies and then you practiced there, but then you did come back. So not many people who go abroad would come back. What made you come back here and start your practice here again?
In 76 to 84, there was a situation where an Indian could not have been a consultant at all. The rules in England were such that they worked on a pyramid system. So as an Indian, I would have never become a consultant. And I was not willing to obey orders the rest of my life. So the only way was to come back, be your own boss, be a consultant. In 86, situation in England changed. And then Indians had the opportunity to become consultants, and people did take that opportunity and became consultants. But at my time, with me, there are at least 5-6 names I can tell you, because they wanted to be consultants and didn't get the opportunity, we came back.
So I wanted to ask you also about your marriage and your family, because the life of a doctor, and that too a surgeon, is very busy. It is always demanding. So when was it that, I mean, you decided that it is career or family? Because youngsters today face that problem a lot, no matter which career they are choosing, that should I choose my career or should I choose my family first? How did you go through that phase?
I don't think you can divide between a career and family. Both of them have to go simultaneous, side by side. And the only thing that is important is a good understanding between both the partners. I met Josna when I was leaving Ferguson and she entered Ferguson. And I used to come back to Pune to meet friends, and that's how we remained in contact. I married 72. That's where I was doing internship. And Josna had done her BA and apparently had a background of working with All India radios. So when we went to Bombay, my father was the one who insisted that she applies for Doordarshan. And she did apply, and she got in. And those were the days when I was a resident. Nobody knew me, but everybody knew my wife.
Yeah, I mean, there's an interesting incident, Purva. I was just looking for many of our audience would know that Mrs. Josna Kirpekar has been a very renowned anchor in Doordarshan for so many years, and she was so beloved by the audiences that, sir, I remember her speaking of an incident where you had to travel to England, and Doordarshan was not letting her go, and it was almost 8 months they did not accept her resignation.
Absolutely correct. Doordarshan were the central government. So there was no state body involved. We didn't know anybody in the center to do that. But they said, when we produced all the papers and my documentation of appointment in England, finally 8 months later, she was released. And then I had a daughter by that time, Gauri, and then both of them joined me in England.
So, by coming back and coming back to India, and then it's a very different system of practice. Probably you had worked in the NHS in England, and then coming back, your choices of starting your own practice or joining an institute or doing both together. So, what were the thoughts at that time that led to your choices as to?
When it was decided that I'm going to come back, my father had a 50-bedded running hospital in Solapur, and he was a general surgeon. I clearly told him that if I stay here, you will allow me to do urology as a specialty, but soon a time will come when say, Deepak, I'm tired, go and do the hernia. Deepak, I'm not feeling well, do the appendix, which I do not want to do because I've already specialized into urology. So we came to a conclusion that I settled in Pune. When I settled in Pune, I was traveling to Sholapur every weekend for 10 years because he would accumulate patients and I would go and operate them in Sholapur. So that was 5 years, not 10 years, 5 years. So that was the clear-cut understanding. When we came back from England, we came on transfer of residence because we had lived there for 5 years. I got every equipment of urology that I used in England with me back home because I knew nothing was available here. So I came equipped with equipment. We bought nothing else from England except my equipment. And that's how I could start. If you want me to continue in Pune, in 1980, there were two urologists, Dr. S.S. Bapat, who was a senior urologist, very well-known father figure teacher, and K.M.K. Rao from Southern Command. I was the third one. And that's where we started meeting and having a club. Setting up a practice was difficult. To set up a practice in a new town, I was an outsider. My medical education was in Mumbai, so I was not a Puneite. And to start something, you need an appointment. And then KEM and Jahangir were the two hospitals which allowed me entrance. And that's where I could then showcase my work. That's what made a difference. Unless you get the patient and unless you show what you can do, people don't understand. And that opportunity is very, very important. At that time, we were 3 in Pune. There was no urologist all the way in Konkan, Goa, Kolhapur, Nanded, Solapur, Nasik, Dhulia, up to Surat. Bombay was a pocket. I used to take my equipment in the car and travel to 400-kilometer radius for a case, just to popularize and let people know what urology is. So my social work is that. Money was not important. It was important to get a case, to go and operate there, let people know that urology is different, what are the advantages, and that's what made the difference.
So is the life of a surgeon, Purva.
Yeah,
What do you
that's an
think?
amazing.
And now all the places that I've just mentioned have 4 or 5 urologists working.
Now,
Being the pioneer in an entire chunk of Maharashtra is such a big deal. Wow.
Indeed, yeah. But I'm sure, Purva, you had a few questions about the life of a surgeon, what anxieties they have. Or...
Yeah, so I heard something that was said by Mr. Amitabh Bachchan. You know, he is such a renowned figure. But even he apparently has a little bit of anxiety, stage fright before he goes on stage. Now, you have been in this field for more than 30 years.
45 years.
45 years.
45.
And such a career of so many surgeries, so many procedures performed, but is it still somewhere, do you get that anxiety before you go in for another surgery?
Yes, I do. Because every case is a major case as far as I am concerned. You cannot afford to make mistake. And every person is a different person. So it's not mechanics, it's not simple mathematics. So even though I have done this surgery 1,000 times before, the 1,001 patient is a different patient. And so you are always anxious what you actually going to see. And so you have to be prepared. You can't take anything lightly. But that's true for everybody. We are sitting here today. Aren't you anxious? In spite of interviewing so many people, women cook at home. But they can't afford to make a mistake. So they are anxious. Even it's a routine job, but you've got to be perfect. No excuses.
So, do you have like a ritual that you do before a surgery or a lucky charm or something that, calms your anxiety, but also you believe that it gives you a good surgery?
You want me to talk the truth? Yep. Then in that case, yes. I do not leave the house before I go through pages of my Guru Charitra. I do not leave the house until I bend down and my parents' photographs, my in-laws' photographs. I don't go. And I have a small Maruti photo in my pocket. I see it every time before I wash.
Oh,
Wow.
wow. I mean, this is the human under the scrubs.
Yeah, I do. Because after all, you are doing something for somebody. Somebody is asking you to do something. You cannot make mistakes. You got to be perfect. And these are probably 3 things that help me being strong and do the perfect job. I don't know. And I have no hesitation. If 10 people are watching, I would still take the photo from my pocket, see it, and go for scrubbing.
Absolutely, sir. I think the state of the mind is so important when you're going in. I mean, even Sachin Tendulkar needs the right state of mind despite all the expert techniques.
Yeah, they do that. They do whatever it is. And what is most important is a patient whom we do not know trusts you so much. You also have to trust somebody. So I'm happy you asked me that question, and that's a fact.
And sir, I mean, getting trust is something that you have done, but you have gone beyond that by venturing into innovation. So, I mean, of course, the whole world knows that you were the first person who brought in the artificial urinary sphincter for in Indians, and I'm sure so many souls must have benefited from that. And you've always been on the forefront of innovation, trying to see what's new. But back at that time when you had to did you face any challenges, or how was the journey in bringing something new to the?
Innovation is the need. Somebody comes across a problem and there needs to be change. That's where the innovation comes in. Now, the artificial sphincter you talked about, it was being done in UK fairly regularly. I knew a CEO of a hospital who went to UK for surgery for prostate, unfortunately landed up with incontinence. And nothing would help him except artificial sphincter. In 80, when I came back to keep myself updated, I used to go every year for 3 weeks to UK, back to my own hospital to see new things happening. So when this situation came up in 84, I went to UK. I talked to the surgeon who was doing artificial sphincters. We organized 3 cases, one after another. He did one. I helped him do second. He allowed me to do the third. As soon as I came back, I did a sphincter on this gentleman. And he was dry. After 30 years after that, very happy. So it was a need at that time. I had to do something to help this gentleman. One more story. There was a glass evacuator that urologists used to bring the prostate chips out. Me and Dr. Bapat used to share one, and it broke. So we had to invent a technique to bring the pieces out. It is known as DVK technique. So again, it's not an invention. It's a necessity of that time, and that's how it happened.
You're right. I mean, you require that. I mean, I don't know whether to call it acumen or that germ in the mind to really find solutions or wait for solutions to happen. I think you're the person who is that proactive person who will go and find a solution for that. But today, as you're seeing artificial intelligence coming in, robotics coming in, where one side people say, okay, that is going to democratize, make expertise available far and wide, at a cost, of course. But experienced surgeons like you say that, no, what I can do with my hands in 30 minutes, the robo might take 1 hour to do that. However precise it, I am achieving the same precision. But looking at the journey happening in the whole medical world so far, since you're talking on the topic of innovation, uh, I'm very curious to know from you, with an innovative mindset, does this really bring value to the medical world today?
Yes, definitely. Because that's the progress. Whether a robo will replace a surgeon is a question mark. But yes, definitely. And AI would be very good as far as diagnosis is concerned. But AI may not be so good as far as the treatment is concerned because of human variations. Ultimately, AI works on input. If you give information about 100,000 people. AI will work on it and derive at conclusion. And if this is what happens, this is it. If this is seen, this is it. This is what AI will do. Robotic technology is entirely different. Robotic technology still has to be driven by a human. It's not the robot who operates. It's the human who sits on a console and uses the robot to operate. And it has tremendous advantages. And this is going to progress, no question. General surgery did everything years ago. One operation separated urology from general surgery. Transurethral resection of prostate. That's where two divisions happened. General surgery did everything. One operation divided laparoscopy from general surgery. Laparoscopic cholecystectomy. One operation which brought robot into system is radical prostatectomy. That is the operation which is best done by robot. Your human fingers don't reach there. Robot gives you a magnification, robot gives you a clarity, and robot hands are like human hands. So robot is going to stay, robot is going to be functional. We believe robot is expensive, but it's not true. In Pune, we have 7 robots today. In Bombay has 14 robots. So it will come down for the common man to have the advantage of technology. But technology is going to progress, and if a surgeon doesn't go along with the technology, he is going to fall behind. He has to be updated. All of us have to be updated, no question about it.
Yeah, great, sir. I think I've kept Pooja quiet for some time.
No, so I do have a question. I wanted to ask you that, they say that surgeons are great artists. You also work with your fingers to create art that saves lives. So what do you think that what is your opinion about this?
This is
About
true.
your art?
This is very true. Surgeons are artists. The surgery itself is a very good art, and you need to work on it, you need to accept it, you need to improvise in it, you need to mature in it. So it is a kind of an art. But a lot of surgeons have different arts also. I know a lot of people who do wonderful painting. I know some surgeons who do very good carvings. I know surgeons who do many things. I am afraid I am not one of them. My other passion is driving, so I drive. That's it.
Okay.
But that's one secret we know, that you have also acted in a film. Maybe a small role.
Yeah. No, actually, Josna was the one who acted in the film first.
Okay.
She acted in Shirdi Ke Sai Baba, which was produced by Manoj Kumar. And then, in fact, because central government did not allow her to go, she stayed back, and those were the 8 months where they finished the film. And I did a small role with Nana Patekar in one of the small serials. Nothing major.
So that is also your art then. How was that experience?
More scared of the cameras. I'm probably facing the camera second time, but yes, I was definitely nervous. And Nana is a good friend, so he helped me for that.
Interesting.
But then you said that driving is your passion. So keeping an incentive, say for a week or at the end of the month, I want to do this, so much loads of work after you have done that, there is some incentive that a human looks to. For example, when I used to do my studies for first MBBS, I remember so much of anatomy, so much of physiology to learn. But I used to have that 30 minutes of Tom and Jerry show, which I used to watch on television. And that was my incentive at the end of the day, that, okay, I'm going to study so much so that I get to watch that Tom and Jerry show. Any such incentives for you?
Driving. Okay. If I've done in a row 7-8 cases, I would just get into the car, put my music on, and drive away for 10 kilometers and come back. Okay. Driving is my passion. I drove Himalayan Rally in 1983.
Amazing.
Wow.
All the way. So I did a rally in UK as well. While we were in 5 years in UK, I drove 48,000 miles.
Oh, wow.
Amazing.
I had
Wow.
seen more UK than the local guys had seen.
Then you have passion for cars, like some specific cars that you like, or any?
No, a good car. Nothing
Okay.
specific.
No specific.
Nothing.
Okay, of course, we are not advertising cars here, but yeah, I was very curious to know.
Nothing specific as car,
So-
but yes, I'm a fan of driving.
If I may ask, what is the highest number of surgeries that you've done in one day?
14.
Oh,
Does that take a toll on you?
No, something that you love, something that you like,
Yeah.
doesn't become a
Take
toll. Physically, you may get tired, fair enough, but doesn't become a toll
Wow, amazing. 14 surgeries in one day.
one day. So far, I've done the highest number of prostate surgeries in the world.
oh,
16,400
wow.
and something.
amazing.
Wow.
Amazing. So, 14 surgeries in a day, most number of prostate surgeries in the world. So many students must have been around you, learning the way your hands work on patients. Today, when I'm at Ethos trying to see how I can help in improving the professional medical education, that is beyond MCH, because till there is a degree, there is a structure, because there are residency programs, there's an exam, unless you clear. But when it comes to adopting newer technologies, do you feel that newer surgeons struggle to get a structured education, or they need to go find on their own? Are they left at bay to figure out a way to access you, or surgeons, stalwarts like you, to really get hands-on? Do you think that there's a struggle for them there right now?
Yes, there is a struggle for everybody, but there is help also. For example, as you said very correctly, up to MCH, programs are structured. When they come out of MCH, they have expected to have done X surgeries, expected to have assisted X surgeries, and that's why they are cleared to come in the market. But as you correctly said, technology is going fast ahead, and new things are coming in. That's why we have conferences. That's why we have seminars where they must attend. There is always education. The guy who says I know everything is finished. So, conferences, educational seminars, they must attend and keep updated. Most of the new technologies are now coming up with simulators. So they have an access. They don't need a patient to use the equipment. Companies are now coming up with simulators. There are 2 Indian companies which have amazingly produced simulators for every practical endo procedure that has come. So simulators are available. They are not very expensive. Third important thing is, there was a time when buying equipment was very expensive. Today also, equipment is expensive. But there are agencies who can rent you equipment for work. So things are, you don't need so much of capital investment to progress and do technologically advanced things. So for the youngsters, there is a lot of horizon which is open. Rental equipment is available, cheaper equipment is available, seminars are available where they go and practice, they can see. And apart from practice, they must keep themselves involved into this to progress. It's very essential.
So, looking back at your life, is there anything that you would like to change despite all the successes and the grand journey that you had, that you continue to have? Is there anything that you would?
If at all I have to change something, I would have expected my father to stay some more time. He went too early before he saw me become a president, become so and so, so and so, so and so. That's my regret. If I can change that, I'll change that.
Yeah, but I'm sure he's there around, been there around you during your surgeries, and having that blessing with you always.
Yeah.
He's been the ideal person whom you look up to, or there's also somebody else?
Father is always idol to begin with, because you're brought up, he brings you up. And as far as teachers are concerned, yes, I would next to my father would put Dr. Kulabawala in Bombay, who was my basic urology teacher, and John Davenport, who I spent 5 years with in England. So, if at all, Guru is my father, Baji, and John Davenport.
Is there any particular book that inspired you a lot?
Everybody reads Campbell, which is the Bible in urology. But I used to love a book called RJ Last, which has very, very practical hints, day-to-day practical hints. RJ Last. I'm sure it is still there. Basic surgical book.
And also any fiction book that really inspired you by stories or something that you have read?
Something that I've read which inspired me a lot is a book called Chariots of God. Absolutely amazing book. If you start reading it, you won't keep it down. It is about the alien, and the book starts off by projecting pyramids, projecting wonders that we talk about, and then how this must have happened. It's a very touching book, Chariots of God. Do read it. Yeah,
Add it to my list.
yeah, add it to your list. Chariots of God.
I mean, it's been an amazing conversation, sir, and thank you so much that you gave us time from your busy schedule. And for the audience, this is actually a Thursday. This is not even a weekend for sir. He has allowed us to speak with him. But I would, of course, have a concluding question for you, me and Purva, of course, that you are the person who has seen urology from its inception to the way it's growing now. How are you seeing the future of urology in India today and even the world?
Very, very bright. Very, very bright. Urology became a super specialty from general surgery. And now you will see urology fragmented into super subspecialties in the future. It's going to happen. There would be people who would be doing only transplant. There would be people who will be doing only endourology. Pediatrics is already separated out. Urogynecology is separating out. But the future generation will have to choose one subspecialty to focus on. And that is how it's going to be the future urologist. So, general surgery, separate out urology, super specialty. Now it is super specialty division, which is going to happen in the future.
Amazing. Purva, any last question from you?
No, I think what he said, dividing urology into super subspecialties, finding your niche, is something that is important for all of us. And I can relate it to my career as well, that I want to find my niche where I fit in.
Correct.
So this is something that I'm taking away. Find my niche.
Yeah, when you start knowing more and more about less, and that really makes you a very special, and your identity is created where you find bringing value to the world.
Yeah. So if you start coning down for that particular reason, that's the person.
Yeah.
And that person is expert because they are doing day in, day out the same job.
Yes. It's been such a pleasure, sir, talking with you.
Thank you so much for calling me here.
Thanks a lot for joining us today.
In spite of my busy schedule, there is a saying: if you want something done, call the busiest man because he has the time.
Yes.
The other kind doesn't have time.
Yes, definitely.
But I'm sure this podcast is going to be an inspiration for not only doctors and urologists, budding urologists or surgeons thinking of doing urology, also to patients who are listening to what a life of a doctor is. Because I mean, here our intention is not to really go into the medical details, but really to understand the human who is under those scrubs. And that was such an amazing perspective to listen from you as to what goes in the heart and the mind of a surgeon when he touches that scalpel.
Yeah.
Thank you so much, sir. And
thank you very much.
Thank you so much, sir.
Yeah.